Hey everyone, welcome back to my channel. This is Rax and I am making another video. It has been a long time since I made videos, and I usually post my live stream in this channel, and it's Raxus Online, and I've decided to make it into a full-blown channel for nursing and for gaming. Okay, and before I begin, I would just like to give a little bit of a disclaimer. Please do not harass the people that I will be mentioning. Everything is public data, but still, as nurses or even just as human beings, let's give some respect to the people. Okay, before, like, I know this topic might be triggering for some people for either sides, but at least keep your cool, give your comments, criticisms, keep them in my comment section below. And if you like this video, give a like or comment or subscribe. Okay, so let's begin. I am going to do this. Oh, yeah, I have to do a window capture first. There you go. Where is it? Okay, so I was basically scrolling on Facebook. Now, I have been a little bit busy this past few years. It's because I am now a registered nurse. I'm working almost 80 hours a week, saving money for some stuff. And yep, there we go. So, I follow one of the infamous or maybe famous vloggers, nurse vloggers on Facebook by the name of Nurse Nemo. And I was wondering, like, what is this message all about? And it says here, thank you for the effort, my fellow nurses. Without your help, we won't be able to take down the wrongdoings of Grace MG. And I was wondering, who is Grace MG? And I did a little bit of search, and apparently she is a caregiver, and she has since deactivated her account. But when I check her Facebook and her TikTok account, she was posting a lot of things, and unfortunately I wasn't able to record some of the stuff that I wanted to make a video about, because I noticed a lot of disturbing stuff in what she was doing. And this touches, I think this would touch professional ethics, leadership, management, and jurisprudence. And a lot of people have been commenting about the situation. So let's start. Uh, okay, nope, not this one. Yep, I prepared some stuff here, but it's like I was just saving some stuff, and I tried my best, but thankfully Nurse Nemo was able to capture several screenshots and actual videos coming from Grace MG's account. So again, Grace MG's account is no longer live. Even if you search for it, you will only see some people commenting about it. So we are talking about Grace MG. I'm gonna try and make this bigger. I don't know how. Okay. So we have here somebody commenting. Again, people, do not attack them. So it says here, Ate Grace, are you not satisfied? You are pretending as a registered nurse. That's why you were instructed by the doctor to inject. You have a rate of 1,500. I assume that this is the rate of 1,500 pesos, which would, if that's the case, then that would be approximately 6,000 a week for a 5-day shift, making it 24,000, I guess. So that's why you have an iPhone and everything else that you could buy, because you are pretending. That's the gist of the conversation. We are not jealous of your iPhone, because I have my own iPhone. And what I'm trying to say is, the bashers are saying, it's hard for me to translate the whole thing, because you're looking like a fool with whatever you're trying to do. So basically, this person is calling out MG Grace, for acting as a nurse and bragging about her salary rate of 1,500, having her own iPhone. And I was wondering, like, who is this Grace? And with the little bit of information that I got, is that Grace is a caregiver. So someone from Tesla asked her full name. If you know, then give the name. So it says her name is Mary Grace Paje. Okay, let's lower this. Okay, we have some comments. I'm just gonna watch a couple of videos that she's doing that I say is very concerning. So we have here Grace is giving. I'm not gonna play up. I'm not gonna play the music. We're just gonna take a look at her giving this doing this procedure. So she is giving an IV injection, and she is a caregiver. That's number one. And look at the pain is the patient is in pain. The patient is in pain. What is she doing? She's not even recapping it properly. What the heck? I have not seen these videos, by the way. I've only seen the thumbnails. The patient is in pain. This is very disturbing. Wow. You know, as student nurses, we were actually not allowed to push IV medications unless if we had strict teachings, and we weren't actually allowed for like first year, second year. It was only we were only allowed like third year. At the end of the third year, when we already tackled a lot of medical surgical nursing, and um, we had our IV training in a way from our clinical instructors, and we could only give it under the watchful eye of the clinical instructor, because the clinical instructor would have to ask us, what is the medication you are giving? How fast are you supposed to give the medication? Do you know what it does? Do you know what to do when something happens to the patient? So this is not right. Even when we became registered nurses, on our first year, like for the first 3 months, when I started working in a hospital, I was shadowing somebody. Somebody was always looking at my actions, and I would have to verify the doctor's orders. Like all of the 12 hours of giving the medication, I don't know if it's already 15 hours, but 12 hours at least. The R, letter R, 12 hours of giving medication to the patient. And I do not think that Grace or Mary Grace or like Mary here is trained to do that, because she is apparently only a caregiver with a TESDA certificate. That's what I infer from the situation here. Let's take a look at other videos of her. Wow, this is disturbing in a way. So she has deactivated. Okay, we're gonna look at this one. Another concept that she has broken, and you are giving a bed bath to your patient. Why are you exposing this patient on social media where other people could see? Even if you cover the face with a smiley, look at that. People who know you would know that you are taking care of this patient. Look at that. What are you doing? You need to, like, this is not allowed in everything. This is a data privacy law violation, cybercrime. If you were here in United States or in Canada, this would be a HIPAA violation of mega proportions. Look at that. The patient is barely, like, everything is bare. This is not good. Honestly, this is not. What is going on here? Let's take a look at another video. There were 3 videos that I prepared. One video was very concerning because, where was that? Okay, yeah, this is the one. This is the one that I was really like, wow. Erythropoietin is a dangerous substance. It need you used to, yet you we were trained to do subcutaneous injections, but the thing with erythropoietin is it's a medication that you need a lot of knowledge in order to give, and she's giving it brachial. No, what the heck? What? Let me just pause for a bit. Give me some air, and I'm gonna show you why I reacted a little bit. Okay, I'm gonna tell you why. I'm gonna tell you why I reacted a little bit. That was. I'm gonna watch the video again just to be sure on what she really did. Okay. So yeah, okay, fine. She's wearing gloves. That's fine. Okay, she is sanitizing the area with a alcohol prep, and that's where she made a mistake. She injected the erythropoietin brachial. This is where you should be injecting. Um, it's like she injected here, but she injected in the middle, like right over here. Even then, we try to inject on the larger part over here. This is like wow, that was bad. And apparently, one of the information that I got from the comment section, giving the benefit of the doubt because I wasn't able to watch the actual videos where Grace was saying stuff, but apparently one of the stuff that she says that she was bragging about being a caregiver and how easy it was because everything she could do or what a nurse could do, she could just Google it. That's what she said. So maybe she Googled it and didn't understand the significance on why you had to use the subcutaneous area of the patient. And this patient doesn't look like she has a lot of meat, like she has a lot of fat on the area she injected on. So she was possibly injecting it intramuscular. That's not good. That's not really good. Uh, wow. Let me take a quick look at the other videos that I found, and apparently, I don't know from another person, Rebecca Camonas. She said she's saying we're gonna use translation. Everyone who posted about Grace MG will be reported. You heard it right. She posted this in public and we shared it. So what? We posted a lot. The question is, does she have a budget to sue us one by one? You must be brave in social media, and you are, well, Maldita is a bad girl. Stand on it. No, no case, no case. You can handle your bashers. I'm going to choose this. Don't make it obvious that you're already depressed. It's necessary that we already know you're fake. You should still be brave even if you're a bad girl. What's Ganern? I don't know how to translate Ganern. So one of the I'm gonna have to I'm gonna have to edit this part. Okay, so this is the part of the video wherein I was just like wondering what's going on here. You have Grace is with her patient, and you know, did she have permission to do this with the family members? Like we have so much problems here in the United States with care, like healthcare workers doing TikToks with their patients, and I this is not good. Like on a personal level, you could get sued by the significant others of this patient, even if you say like, hey, I'm very close with the significant others. Anything could happen. Like you could possibly like piss off one of the family members of something unrelated, and then the family member could say, "Ah, I remember that she made a video about this one, and I can use this to sue her." So right. So that's the thing. That's one of the things that she is putting herself into. So Nurse Nemo was really going at it. So Tesla has a website wherein you could search for the caregivers, which is a very good thing. Caregiving is should be a controlled profession due to the fact that it deals with life. And I know Tesla has it. So it says here that record not found for Grace MG. Somebody emailed. Okay, posted last July 13. So she's capitalizing on some sort of rivalry between nurses and caregivers. The enemy of the caregivers are the registered nurse who don't want to be defeated, and caregivers who are not accepted by private employers. It's not only the rate wherein we are fighting about, even with the PRC versus the NC2. NC2 is the kind of like the certificate or license given by TESDA to caregivers. Instead of helping each other, we are like in a way snitching against each other. Reality check. But that's not the problem. You see, we have scopes of like nursing scope. We have scope in like where you are able to do stuff, and you were doing stuff like injecting a medication. You were there was also one video like there's one video that I need to show you guys. She did something wherein, yep, this is the one. Although the actual video is gone now, I wonder if I'm able to like use Internet Archive for this one. But the problem is, if nobody archived it, then the actual account would be gone. Nope, it hasn't been archived. So I'm just gonna show you this one. So it says here, thank you for sharing your knowledge and experience, ma'am. Grace replies, welcome, ma'am. Thanks for watching. Hi, ma'am. What is the solution you used for flushing? Is it sterile water or natural saline solution irrigating? And then Grace replies, it's irrigation and mixed with 5 ml of acetic acid, which she's using white vinegar. Yes, you heard it right. It has white vinegar. Doctor mixed it in the hospital. So I think she's getting some solution from the. I'm gonna have to disconnect my VPN. So here's the thing. It is true that we used acetic acid in irrigating a patient, but only for the bladder. Okay, and this is the video that she was. I was trying to find this video, wherein again the patient is exposed. You're not supposed to be posting this. Give privacy to the patient. So what she's doing is she's irrigating the Foley catheter of the patient to irrigate the bladder of the patient. And again, that is an interdependent nursing action. You need doctor's orders for that one. Like, I'm not sure how did she get this job, by the way. Like this is surprising for me. There are several other posts. I'm gonna do this and there. So says, but these might be comments. Wow. So I think these are fellow caregivers. So somebody is talking here. The person is kind of saying like, nurses, we are studying for 4 years, and caregivers are only studying for 8 to 9 months, and their level of knowledge is for registered nurse level. And I'm sorry, but we're immediately sorry. We just want to increase our knowledge. It's the future for our family that we would be able to use it. So we should be sharing our knowledge without dapat share knowledge tayo, wag pataasan ng knowledge, not pride. So we should be sharing our knowledge, not to compete on who is more knowledgeable and who has more pride. So Grace MG replies, correct. So basically, what they are implying is that since nurses had to learn for 4 years to be able to do the stuff that Grace is doing, and they are alleging that caregivers only need 8 to 9 months of studying and they are able to function as registered nurses. This is a huge fallacy and is very dangerous. They should not be thinking like this. Okay? This is not good. You are only caregivers. I'm not saying it like you're only caregivers because that's your lowest level. Nope, it's not that. You have your We are allied health workers. You have your own duties and responsibilities. As a registered nurse, we have our own duties and responsibilities. It's the level of responsibility that is different here. You're not supposed to be doing what nurses can do. And if we are doing something nurses can do, it's either because we have delegated it to you and we know we are right by your side, or at least know that you are doing this to a patient. Now, there's a lot of things that I've already demonstrated that was wrong. And for example, the erythropoietin, if you accidentally injected it into the muscle of the patient, that could cause a severe reaction. It will not work because it will also erythropoietin needs to be absorbed through subcutaneous layer. You don't have the knowledge on why you are using acetic acid to irrigate the bladder. And then I just saw you inject something intravenous, and the patient was moving. The patient is male, apparently. The patient was moving his arm in pain. So you didn't you could Google the fact that you could inject intravenously, but you did not know that injecting it in that way causes pain to the patient. What if the catheter infiltrated and you're no longer injecting the medication intravenous? The tip of the catheter has already lodged into the subcutaneous, and then you're going to cause phlebitis. You're going to cause inflammation on the IV site because it has infiltrated into other tissues. So that's a lot of mistake that a nurse has tried to learn for the past 4 years in order to not make those mistakes. Okay, that's the difference here. I was planning on only doing this for like a very very short, very very short video, and we have somebody that would have more. Oh, let me move my face a little bit here. I have somebody here that has more authority in the matter. This person is a nurse at the same time and attorney. So let's take a look at his post. Nurses versus caregivers. Let's clarify some facts about what nurses can do versus what caregivers are allowed to do. Very nice introduction there. There's been a lot of talk online about a caregiver who was seen administering IV meds and through other routes, computing IV drops, doing invasive suctioning, yes, flushing and removing catheters, and posting videos with watchers and patients inside their hospital rooms. I won't be tagging her, and I respectfully ask those who will comment not to tag her either. This is not for hate. This is for awareness and patient safety. So this is the law that we have. Under the Philippine Nursing Act and PRC Board of Nursing guidelines, certain medical procedures are allowed only for registered nurses. Some even require direct supervision by doctors and or specialized training. For example, the PRC Board of Nursing Resolution Number 8, Series 1994, states that a nurse must first complete a special IV training underqualified nursing administrators before they can legally administer IV drugs. That is actually true. I had to do that on my first year of nursing. The law is very clear. If you are not a nurse, you cannot perform IV insertion or administer IV medications. If you are a nurse but not IV trained, it is still forbidden. Other invasive procedures, including catheterization, suctioning, and NGT feeding, are serious medical interventions that require proper clinical judgment. These are not basic skills. They involve life or death precision, and errors can put patients at serious risk. I'm going to give you one example that I actually experienced in real life, because I was also like a part-time caregiver. I was already a nurse, but I took some sideline wherein I acted like a caregiver for a patient, and knowing the fact that the patient is not in a hospital, I am not in direct contact with a doctor, I did not do my role as a nurse. I just did what a caregiver would do. And if there were any information or any things that I need to do that required my my skills as a nurse, I had to contact the doctor, the managing doctor directly, and from then on, I maintained a professional relationship with that doctor, and that included even giving pills to the patient. Okay, even giving pills to the patient, I had to inform the doctor, this is the vital signs of the patient. The patient has a blood pressure. Like I remember, the patient had a blood pressure of 90/60, and the patient was about to get the medication for antihypertension. So I had to clarify with the doctor, am I able to give this to the patient even though the patient has for the past 3 days experiencing this type of blood pressure? So these are things that I had to learn in the 4 years of nursing. And another thing about suctioning. Suctioning is not just a basic skill for a caregiver, and I really do not understand why some caregiver schools include suctioning for the patient without giving a lot of information. Like, for example, suctioning, how many seconds do you do it? What's the specific procedure in doing it? What are the times you can do it? And what are the specific disorders and diseases wherein suctioning has to be controlled, that you need to have certain apparatus and like sets in the room if something happens with the suctioning. Like for example, if the suctioning causes injury in the trachea, what do you do? Who do you call? NGT feeding, again, it's still an invasive procedure. A lot of things could go wrong. Like, are you checking for the placement of the NGT? What if you are feeding the patient and the tip of the NGT is already in the lungs? Do you know what to do? In the first place, are you supposed to feed the patient if you are doubtful on where the catheter, the tube placement is? So these are very, very important. So let's continue. Posting photos or dancing in patient rooms for content is also not acceptable. Patient privacy is a fundamental right. Whether you are a nurse or a caregiver, showing a patient's face without consent is a violation of confidentiality and professional ethics. Hospital rooms are places of healing, not stages for content creation. Let's be clear. Caregivers play a vital role, especially in assisting with basic needs and emotional support. But caregiving is not nursing. Caregivers are not trained or licensed to make clinical decisions or perform invasive procedures. This post is not meant to attack anyone. This is a reminder that healthcare is built on trust, safety, and boundaries. Whether you're a nurse, caregiver, or content creator, know your scope, respect your patients, and honor the profession. Yeah, we have some comments here. Providing care that is not safe is not care at all. And we have some people repeating what you said in some of her videos. Sorry, attorney, but according to her, Google is the key. Wow. Wow. Oh no, so we have another issue here. I heard she's not even a certified caregiver like some of us here. I got shook from what I heard that she got her NC2 cert in just 2 days. No, like I made a like I funded a friend's like when I arrived here in Canada, I had the extra income. I helped a friend get her NC2, and it I know it was like 6 months with 2 months of on OJT, and she had her graduation after doing a return demonstration. So it took like about eight months for that for that friend to finish her NC2 certificate. Basic knowledge for nursing, 6 months. Oh yeah, 6 months demo training, and then there's an assessment period, and then she just got her NC2 in just 2 days. And the thing in the Philippines is caregiver is actually like I'm not saying like the lowest in terms of ranking just because that person would have no authority or something else. Just like on a hierarchy of healthcare workers, we still have nurse, nursing aide, and then caregiver. Under like on the line of nursing aide, we also have our wardman. So there are like different levels or hierarchy in the healthcare industry. So this is crazy. Oh, that's something got repealed, but anyway, it's still the same thing. This is this is a profession that requires a lot of a lot of learning, wisdom, decision making, experience. It's not something that you could say I could just Google it and do it. So again, when I ending this video, I would like to reiterate: please do not attack the person. I believe that she is already deactivated, and some sort of justice is gonna come to her. And the people who are commenting about this, the attorney, the blogger, and everyone else, please do not attack them. They were right in their assessment of the whole situation. So with that said, nurses, let us be mindful in our comments. We can educate without having to irritate the person. And forgive me for my outburst. Like I've gone through 4 years of nursing to have a bit of trauma from getting scolded by a clinical instructor for doing the wrong thing or answering the wrong question, and seeing that this person is doing this and that kind of reminded me of a little of that of those learnings. Those learnings helped me a lot in becoming a nurse today. And you know, I would encourage Grace, if you want to become a nurse, just I invite you to become a nurse. Like you want to do what a nurse does, please do it. You are welcome to do it. I'm just saying that what you are doing right now, you are technically, legally not allowed to do it. That is all. And have a good day, everyone. This is Raxus and signing off.